In the name of Allah, the Beneficent, the Merciful. Welcome to the world of biophysics. Due to coronavirus, we have to continue our online class. I'd like to suggest you stay home, stay safe. Coronavirus safety. Follow these easy steps to help prevent the spread of COVID-19. At first, the first step is disinfect surfaces around your home and work. Number 2, wash your hands for at least 20 seconds. Number 3, sneeze or cough, cover your mouth. Let me introduce. I am Mohammad Muqtadir Hossain Bhuiya, lecturer, Department of Physics. Observe following diagram. Observe this diagram and think what you have observed. It's like a pulse, and think by yourself and observe this diagram too. Here the diagram have 3 parts: part A, part B, and part C. Observe following diagram and think what you have observed. Okay, we are going to discuss about chapter 14, Physics to Save Life, and today's lesson is about ECG, ETT, and endoscopy. And number 2, instruments used for diagnosis of diseases. And next lesson is based on angiography, radiotherapy, and isotope. Key points of this chapter is ECG, ETT, and endoscopy. Here ECG is electrocardiography and ETT is exercise tolerance test and endoscopy. And we are going to discuss all these key points in our discussion. In previous lesson, we have learned about biophysics, Jagadish Chandra Bosu, and X-ray, CT scan, MRI, and ultrasonography. And today we are going to learn about ECG, ETT, and endoscopy. By the end of this lesson, students will be able to explain the application of ideas and theories of physics in the instrument for diagnosis of diseases in medical science, explain about ECG, explain about ETT, uses of ECG and ETT, explain about endoscopy. Now we are going to discuss about ECG. ECG is electrocardiogram. The heart produces tiny electrical impulse without any external stimulation. This electrical signal spread through the heart muscle to make the heart contract. We detect the impulses by the ECG machine. This is a diagram. Observe this diagram and at first look at this diagram. Here we have electrode and there are mainly 10 electrode lead. 2 is connected to head, 2 of them is connected to leg, and other 6 of the electrode is connected with the chest. And with this electrode, and after getting ECG tracing from ECG machine, we get a pulse, that is ECG pulse. And after viewing this, after printing this ECG pulse, we compare this with normal ECG pulse, then by which we can diagnose disease. And uses of ECG is to measure the rate and rhythms of heartbeats, palpitation, irregular and fast heartbeats, chest pain, etc., by which we can diagnose abnormal heart rhythm, heart is very fast, slow, or irregular, Number two, a heart attack which happened recent or sometimes ago. Number three, an enlargement heart. Now we are going to discuss about the practical working procedure of ECG. Look at this video, and by which you will able to understand the working procedure of ECG. ECG here, ECG is electrocardiogram. At first, to do electrocardiogram, we have to use some gel in chest, and by this by using gel to our chest, to our right hand, then to our left hand, and to our right leg, and uh, to our left leg, we use this gel. Then ECG is the abbreviation of the word electrocardiogram. The electrical and muscular function of the human heart can be observed by doing ECG. You know that without any external stimuli, the heart can generate small electrical signals, and these signals spread through the heart muscle, and thus the heart beat occur. We can detect this electrical signal using ECG machine. The heartbeat and the rhythmicity of the heart can be measured using this machine. ECG signal give indirect evidence of blood flow in the heart. Electrodes are attached to the patient's body to receive the electrical signal during ECG examination. Two electrodes are placed on the two hands, two on the two legs, and six on the heart adjacent area of the chest. Electrical signals are collected from each of the electrodes. When these signals are printed, it is called electrocardiogram. Here, two electrodes are placed on two hands, two electrodes are placed on two legs, and six on the heart adjacent area of the chest. And electrical signals are collected from each of the electrodes. When these electrodes collect the pulse from two hands, from two legs, and from the adjacent area of the chest, we with the help of ECG machine, we print these signals, and that is called electrocardiogram. This the electrical signal obtained from each of the electrodes of a healthy person have a normal pattern. If a abnormality develops in heart of someone, then the signals obtained from the electrodes will be different from normal pattern. Generally, an AECG is done to detect the cause of disease when a person experiences palpitation, irregular or rapid heartbeat, and chest pain. Besides, now we are going to start the ECG machine, and this loading after 100%, we can uh, detect the pulse, and by this ECG machine, we can do observe the abnormal condition of the heart, that is irregular heartbeat, or if a heart attack occurs, or if the heart gets dilated. And after getting started, the electrical pulse shown in the monitor, and by pressing the print button, we get the electrocardiogram signals in printed form. That is the printed form of electrocardiogram, and this is the pulse from two hands, two legs, and six on the heart adjacent area of the chest. And with this, we get the signals are printed, and it is called electrocardiogram. The electrical signals obtained from each of the electrodes of a healthy person have a normal pattern. Here, the normal sinus rhythm is observed from uh, cardiac electric axis normal. This is the normal uh, rhythm that we have observed for this patient. Thank you. Now we are going to discuss about ETT, that is exercise tolerance test. ETT is a kind of or is a type of ECG, exercise tolerance test. It is the test of stimulated heart, electric activities or functions, rate of rhythm of the heart during exercise are recorded by ETT. Actually, ETT is a special type of ECG, and it is recorded during exercise, and this is the ECG machine. And um, when the patient do exercise in a treadmill or um, riding bicycle, then we get the pulse from this patient, and that is ETT. Actually, it's special type of ECG. This is the same procedure by which we can observe and we can detect the signal from the patient, from his hand, leg, and from his chest. And this is the ECG machine. And after pressing the print option, we can get the electrocardiogram pulse. This is also same type of image. This is ECG machine, and this is a treadmill. And when we do exercise, we record the ECG, and the recorded ECG during exercise is called ETT. And by ETT, we can diagnose coronary artery or partial blockage in heart. Now we are going to discuss about endoscopy. Endoscopy means looking inside something. By the endoscopy, we means looking interior of a hollow organ or cavity of the body for medical reasons using an endoscope machine. This is an endoscope machine, and by which we can uh, observe the inside of cavity of, of the body for medical reasons using an endoscope machine. At first, we observe light, uh, and we observe from this side, and uh, in this uh, in this tube, uh, there is total internal reflection, and from inside the patient, the light goes for total by the total internal reflection, and then we can observe this light from outside. By this, we can uh, observe the interior of a hollow organ or cavity of the body for medical reasons using an endoscope machine. Endoscopy have many uses like the irritation, ulcer, inflammation, and abnormal tissues growth in the internal organ, the lung, central partition of the chest, the stomach, small intestine, large intestine, or colon, the female reproductive organ, the abdomen and pelvis, the inside of urinary bladder, the nasal cavity, and sinus surrounding the nose, the ears. That is the use of endoscopy. The process of seeing inside stomach by endoscopy is also called esophagus, and it is a procedure by which uh, see the inside of stomach, and this is esophagus, stomach, and duodenum. Endoscopy helps evaluate persistent upper abdominal pain, nausea, vomiting, bleeding, difficulty swallowing. Endoscopy can detect inflammation, infection, tumor, and ulcers. The process of seeing any internal organ or cavity directly from outside is called endoscopy. An endoscopy machine can be used to investigate the interior of hollow organ within the body. Before the procedure, ibuprofen medications and sedative, blood pressure, pulse, and oxygen monitored. Local anesthesia is given. There are and asked to lie on the left side, supportive mouthpiece. There are two transparent tubes in an endoscope. Bright light is projected into the patient's internal organ through a tube from the outside is done with the help of optical fiber. Light undergoes total internal reflection inside the fiber, and so tube doesn't need to remain straight and can be twisted and turned after the damage or a diseased organ of the body is lit up. An image of that area can be seen through the second tube. To see anything, the body needs to remain in a straight line, but it is not possible to look at the interior part of the organ inside the body in a straight line. This is why optical fiber are used, where total internal reflections of light take place, and thus the light can go through curved path. After the procedure, monitored in recovery room, possible sore throat or bloated feeling. Now we are going to discuss the knowledge-based question about these topics. What is normal ECG? The heart is beating in a regular sinus rhythm between 60 to 100 beats per minute, specifically 82 BPM. All the important intervals on this recording are within normal ranges. What is the normal heart rate under a stress rate test? Your target heart, heart rate during a stress test depends on your age. For adults, the maximum predicted heart rate is 220 minus your age. So if you are 40 years old, the maximum predicted heart rate is 220 minus 40 is equal to 180. Next knowledge based question is, what is the full form of ECG? And the full form of ECG is electrocardiogram, which is used to detect the rate of vibration of heart. There is ECG. What is the full form of ETT? Exercise tolerance test, which test is made to identify partial blockage of coronary arteries. That is ETT. Knowledge based questions. How the rate of heartbeat and rhythms is measured. Identifying electrical signals, by which test we detect impulse of heart. That is ECG. How many signals are identified to take a computer picture of heart? That is 12. And comprehension based question. Explain how does an exercise treatment test that is ETT works. Small sticky patches or suction cup are placed on your back and chest. Blood pressure and heart activity are monitored while you are resting. Monitoring continues while you walk on the treadmill. The test is stopped if heart activity or blood pressure changes a lot, you have chest pain, or you become too tired to continue. This is one of the quickest, safest way to check the function of your heart. Now we are going to discuss about a creative question. That is, MRI and ECG are two available tests widely used in modern medical sciences. MRI is a painless and safe disease diagnosis method. On the other hand, ECG is diagnostic procedure that is routinely used to assess the electrical muscular functions of the heart. Number A is, what is tomography? Number B, what is meant by CT scan? We know the CT scan is computed tomography scan that we have discussed in our previous lecture. Now the question is, how does the method work? Mention the stem, describe. Here, two of the process have mentioned. One of them is MRI and another is ECG. The MRI part have discussed in our previous lecture, and in this lecture we have discussed about ECG. Our next question is, how is ECG test done and what disorders of the heart can be detected by it? I think in our previous slide in ECG part we have discussed this. Now we are going to discuss the MCQ part. Read this question and try to answer this question, and read this question too. And read this question. I think all of you are able to answer this MCQ. And first one answer is ECG. Second one the answer is 10. For third one the answer is endoscopy. And read this question and try to solve this MCQ. Here for this MCQ, the answer is number D. Okay, we are going to give you homework regarding to our lecture. That is, how is ECG test done and what disorders of the heart can be detected by it. Discuss elaborately with the help of a diagram. There is homework for you, and another homework for you is explain endoscopy and write the uses of endoscopy. Do you have any question? I think you may have some question regarding to our lecture. Thank you and stay home, stay safe.